guys, welcome to another YouTube video. And before we get started, I just wanted to say happy holidays, happy new year. We're almost in 2021. It's a full moon tonight. I think a lot of people are feeling the energy, really looking forward to a new year, myself included. So I just wanted to say happy almost new year. By the time this video actually goes up, it might be the new year. But I wanted to put together a little video for you guys all about comprehensive lab work because I get a lot of questions about comprehensive lab work in general. A lot of people think that they have comprehensive lab work done by their doctor, and then they end up sending me the report, faxing it over, or bring it for their visit, and it's pretty sparse. So we're going to cover what qualifies as comprehensive lab work, what we're looking for, and really kind of the why around that, because some people are really just a little bit confused as to why do I need all these tests, or do I need all these tests, or why did my doctor not order these if these are things that are applicable to me and can help my health. You might be wondering, why would we even order comprehensive lab work? Or you might be wondering, why would my doctor not order the comprehensive lab work on my regular visit? We're going to answer those questions here in this video, but the comprehensive lab work is providing the most in-depth, detailed picture of your entire health from every single organ system that we could potentially look at. We're doing as much as we can to take a look at everything collectively. And the reason why is because you do not work in isolation. So imagine a puzzle. You have pieces of the puzzle. You have different pieces of the puzzle. Each piece of that puzzle ends up making that puzzle the way it looks. If you're not doing the appropriate testing, you're not really getting the full puzzle or the full picture of someone's health. And a lot of times things go neglected. If you're not looking for them, you're not going to find the right types of things. So the comprehensive profile really allows for a further in-depth view, almost like a broad spectrum, what's going on with every single organ system. You might be wondering, why would my conventional doctor not order this? Why have I not done this before? It's typically not something that's looked at from a conventional model, because what happens in the conventional model is that you typically will go to a specialist who is looking at that specific organ. So for example, you might go to your endocrinologist, and your endocrinologist is looking at your thyroid gland or your adrenal glands. You might end up going to a cardiologist who's just looking at your heart. You might end up going to a rheumatologist if you have joint pain. You might be going to all of the ologists under the sun, and each of them are specializing in a different piece of the body. And while that's very helpful, they're very knowledgeable in what they know, they only know what they know. So they're not really connecting a lot of the other pieces to the puzzle. And that's where the comprehensive profile comes in, because we're able to look at you in totality. We're able to integrate your thyroid with your adrenals. We're able to integrate your liver with your gallbladder. We're able to integrate your spleen. We're able to integrate your immune system. All of the cells together are connected, and always go back to that puzzle piece. I guess the way you can think about the comprehensive lab work is you'll find a lot of functional medicine providers or holistic doctors are going to be the ones that are ordering the comprehensive profile. Now, buyer beware, it is a lot of blood. A lot of blood. So if you're not good with blood, probably not the best thing for you. But it ends up being about 12 pages of information and about 12 vials of blood. Maybe a little bit more information and maybe a little bit more vials depending on the person. We can do it in pieces for some people. Most people like the blood work, I have to be honest, they're eager for it. And it really gives them clarity on what they've been dealing with. Some people are saying, I cannot find answers to what's going on with my health. I've been everywhere. And typically I'm the last person that they come to see. They share, I've been to all of the ologists and you're my last hope. What can you look for? And to be very honest, we open Pandora's box, because a lot of what we're looking for are things that have never even been addressed or even viewed. And we'll talk about what those things are, but it's very important to do a comprehensive profile at least one time per year, because it's going to be the most in-depth, most informative, most integrative way to take a look at your health and to see how things are connected. Now, I have a blood script here. This is a little sample. This one is from LabCorp. Just happened to pull a LabCorp script. And I have a Quest script as well. I have a couple different scripts here, and I wanted to share with you guys a little bit about the types of testing that we can do. Now, I know some of this stuff might be like, oh my gosh, it sounds like alphabet soup to you guys. The point of the story is that we can look for a lot of things in your labs. We can look for a lot of things. So let's just start with something. For example, I had a consult today with someone. He was sharing with me all about his hormonal issues, about his testosterone, about his dihydrotestosterone, a lot of things going on, some prostate things. The point of the story is that we did a full comprehensive profile, and that's typically how I introduce new patients into my practice. That's a very great start place. It's a great opportunity to provide a baseline of where your health is. Most people, I would say 100% of them actually, get comprehensive lab work if they're working with me and they have the coverage. So let's talk about the hormone profile. So for example, you might be watching this video as a female or a male thinking, I think I'm dealing with a hormonal problem. What do I do with this? Step one is to look at your hormones and to clinically correlate with your symptoms. So looking at the hormones means we're looking at all of the sex hormones that include testosterone free and total, DHT free and total, cortisol, okay, AM cortisol, morning cortisol, between 7 to 9 a.m. All three derivatives of estrogen, Pregnenalone, and Progesterone. Those are the major sex hormones that we look at in the pathway for hormone imbalance. When I review people's lab work and they suspect they have a hormone problem, maybe they've only had 2 of those tests done. So when I'm ordering blood work, I'm looking at everything in that category. For example, mold. That's another panel that I order, very comprehensive mold panel, looking at all different derivatives of mold, many different toxic types of mold, black molds, aspergillus, lots of different species of mold. That includes about 7 to 9 different species. Why would we look at mold? Because for a lot of people, mold can create symptoms of neuralgias. It can create symptoms of brain fog, inflammation. Breathing in or ingesting mold into your body can create headaches, nausea, inflammation. It can actually set off inflammatory markers. Even skin issues can be coming from irritations to mold. It actually heightens the immune system. So when somebody is breathing in mold and they're not aware of it, it can really hurt their immune system and predispose them to picking up colds, flus, and all sorts of weird things with their immune system. Autoimmune conditions, we start to notice they have a positive ANA, a positive anti-nuclear antibody, all sorts of kooky things start to happen. So a mold panel is another one. Metals, that's a huge one. Now, for those of you guys that know me personally, I actually think it's right here. I was supposed to see Tony Robbins this year, and I didn't get a chance to go. I was signed up for Unleash the Power Within. Here is my ticket. Long story short, I'm a huge Tony Robbins fan. The point is that Tony Robbins, if you know him, he doesn't just do something like a little. Tony Robbins is, I'm jumping into the pool with both feet and arms, and I'm going to weight my body down because I'm so committed to this. Long story short, he ended up having mercury poisoning, and he shares this actually in a couple of his YouTube videos, and I think even in one of his books he talks about this. He was really, really sick. And he knew something wasn't right, but he didn't know what it was. He was having a lot of brain fog, a lot of dizziness, a lot of neurocognitive things, forgetfulness, switching of words, neurologic switching. A lot of things were happening for him. Something wasn't right, but Tony Robbins, the man that he is, just pushes through nonetheless. Long story short, he connected with somebody that started to look at metals. Well, Tony Robbins had wanted to get into a really good physical physique. He really wanted to shape up his body. So he decided to eat fish and I think vegetables like 3 or 4 times a day for weeks on end. He ended up having mercury poisoning, which is a heavy metal from the foods he was eating consistently and not letting enough of that stuff flush out. Metals in particular have a lot of neuropsychiatric things that can happen. People become very forgetful. Their temperament, their mood can change. They can actually feel aches and pains in their nerves. They can feel lightning pain, shooting pain, sharp pain. They can be like, wait a second, what was I supposed to do? Forgetfulness, a lot of head up stuff, if you will. And it can, like I said, cause problems with the immune system long term. So that's another thing included. I probably should recap. So far we've talked about sex hormone profile. We've talked about mold. Now we're talking about heavy metals. Another thing that we can order is in the comprehensive lab results, looking to see all of the inflammation in your body. There are specific cells that are looking at inflammation. For example, high sensitivity C-reactive protein or erythrocyte sedimentation rate. Those are the top two. One of them is an acute phase liver protein, so it tells us about the liver, which is a dual organ. It's got both a lymphatic and digestive perspective. We'll talk about the liver in a second. But the point is that we can look to see what's going on from an in-depth perspective with the liver, what's going on with all of the cells in that family, if you will, when we order that type of profile. A lot of people feel inflammation as when you touch or palpate, things hurt them. They feel achiness, they feel a lot of joint pain. Cognition is another thing that's affected. A lot of times physical pain. If someone's in inflammation, they're going to feel a lot of physical pain, neck pain, achiness, joint pain, and it doesn't just live in one specific area. Yes, it can be exacerbated in a specific spot, but when someone's under systemic inflammation, meaning from head to toe, that inflammation cascade or that inflammation process causes fire in the body, heat in the body. And those two tests, the hsCRP and the erythrocyte sedimentation rate, are really good kind of general markers. I have had people come to me that had no idea how much inflammation was in their body. They've had no idea that they had high levels of cholesterol. And the combination of the two, high levels of hsCRP with high cholesterol, we typically are going to go look at the arteries and see where there might be some occlusion or some blockages. You can change and save someone's life. I've actually had that happen in clinical practice where I ordered the comprehensive blood work. We realized that this needed a referral out because this was very alarming. You know, we don't just let people be time bombs. We don't just let them be time bombs ready to tick. We have to make some decisions and make sure we're triaging and getting the person to the appropriate person. Long story short, we did enzyme therapy. I had been working with him. He's actually a patient of mine now for probably 2 years of time. And that finding, I actually received a call from his cardiologist saying, thank you for finding that, because we ended up going in and finding about 90% blockage. So he ended up having surgery. He's very comfortable with me sharing the story. I actually might interview him. I'm trying to get him on this, but the point is that when you are looking for the right types of things, you're able to be very proactive and you're able to prevent. Disease prevention is root cause medicine. Let me say that again. Disease prevention is root cause medicine. That is the goal. When someone is coming in and we're looking at their cells and we're looking at their chemistry, we want to prevent scary things from happening. We want to optimize your body. That's what this is. I would say functional medicine, holistic medicine is like the total human optimization program. That's really what it is. We want you on. We don't want inflammation. We want your cells moving and grooving. We want your metabolism revved up. We want clear skin. We want deep sleep. Those are the goals. So inflammation is something that we can order. We also can look at neurotransmitter profiles. So things like glutamate, dopamine, serotonin. Those are that's another set of functional medicine style blood work that is on the comprehensive. I'm looking to see your neurotransmitters. Think about neurotransmitters as partly your mood. So for example, serotonin. Serotonin is a hormone that makes us feel happy. It actually is made in our gut. 90% of our serotonin is made in our digestive system, and it travels to the brain and it has a specific job. Dopamine is another really happy hormone. Dopamine stimulates an area of our brain called the ventral tegmental area, which is the pleasure center of the brain, the reward center of our brain. So if you have a patient or someone's coming in saying, I feel low energy, I feel unmotivated, I feel depressed, I feel just maybe melancholic, I'm not sure what's going on, can you look at a neurotransmitter profile and take a look to see how they're producing these neurotransmitters? Are the names? Absolutely. And that is something that we look at as well. And sometimes we want to check in as well with the digestive system if someone's having issues with the neurotransmitters or inflammation, because that's a big source of why there's imbalances in that system. Everything comes from the gut. A lot of things come from the gut. That's another profile. So I just want to see here what else we want to look at. Basic stuff, I always order the CBC, the lipids, the hemoglobin A1C. I'm looking at your blood sugar. A couple of things that are a little bit different that I order, though, that I want to share with you guys that tell me about your pancreas. I order an insulin test. I order whether it's fasting or random insulin. I also order glucose, and I order amylase, lipase, and also hemoglobin A1C, which is a blood marker, glycosylated hemoglobin. It's looking at how well you've been dealing with sugar or carbs for 3 months of time. So it's not just a test that's right now. If I were to pull your blood right now this is what we're finding. It's actually a test that is 3 months of how well you've been dealing with glucose. Are you using starch? Are you having problems with carbs? Why all of that matters, it's not just from a cosmetic perspective or aesthetic, but when you have high levels of blood glucose floating around, you will feel anxious. It will create anxiety, and it also puts a lot of stress on the pancreas, a lot of stress on the liver indirectly as well, and it drops your immune system. So when your blood glucose goes up above a certain number, your white blood cells, your immune system drops by 75% for like 3 hours of time. You don't want to be having problems with your pancreas and your inability to digest carbohydrates, because that will cause weight gain, that will cause moodiness, that will cause sugar cravings. You're not really digesting sugar. It's actually just sitting in the bloodstream. It gets stored as body fat. Those are all the things that we look at as well. So we can look to see the pancreas. Think of it like this. I guess the best way, I know I'm saying a lot. If you're watching this, you're probably like, this is a lot. But think of it like this. Each organ has its own set of chemical compounds or constituents that we can look at. The thyroid, let's go there because that's another very comprehensive profile. I have people that come to see me with thyroid dysfunction, whether it's diagnosed or undiagnosed, when they walk into the office, and they say, I've had my thyroid tested. They bring me the report. It's a TSH and a T4. You haven't had your thyroid tested. And I'm joking. I'm really not mocking anybody. It's not the fault of anybody. How would you know as a patient? If I was a patient and I didn't have the knowledge that I did, how the heck would I know what I should be tested for? That's not my field. You're putting trust in the provider, but it's very limited. I'm going to be very honest. The systems are so different. Conventional and holistic, they're entirely different animals. The best way I could describe it, it's like political. It's like the Democrat and Republican Party. They are opposite. They think exactly opposite. Why? I don't know why that is. It's just the model that we live in. It's just the paradigm that we live in. So I don't want to fight that. I want to just accept that that's what it is. But the point of the story is that each organ system has its own labs. Thyroid, back to the point of the thyroid, is that when I'm looking at someone's lab work, it's very sparse. Where is the reverse T3? Where is the free and total versions of thyroxine? Where is the free and total versions of triiodothyronine? Where is the TSH? Okay, that's typically one of the things that they will order. Where are the antibodies, the anti-TPO antibodies? Where is anti-thyroglobulin antibodies? Where is the thyroid? Where is it? It's almost like you are trying to bake a recipe and you've only been given eggs and almond flour. But we're baking banana bread. Where are the bananas? Where are the maybe chocolate chips that you might put in the banana bread? Where are those ingredients? You can't create the end product without knowing all of the information. And that's where we want to do the comprehensive, to make sure that we're ruling in and ruling out everything about the organ as much as possible. So thyroid is another one. Viral load, this is a really good one. A lot of people want to know about viral panels. I do order viral panels and bacterial panels. You can think of that as a self-infection profile, which that just means that I'm specifically looking for Epstein-Barr virus. I'm looking for cytomegalovirus. I'm looking for toxoplasmosis. I'm looking for now SARS, COVID-19. I'm looking for bacterial infections, Borrelia burgdorferi, which is Lyme disease, any tick-borne infections, Bartonella Hensley, Babesia microti, parvovirus B19, anaplasmosis, ehrlichiosis, all of these tick-borne bacterial, viral, even parasitic infections. I'll put Candida in this. I look at a Candida immune complex as well in the lab work. You can think of this profile, this comprehensive piece of the lab work, looking to see if there's critters, what type of environmental pathogens might be irritating your immune system. Why that matters, and I think a lot of people can resonate with this with everything going on right now in our world, viruses can make us very sick, and each virus has a life cycle that affects a different tissue of origin. For example, we saw a lot of people that were having SARS or COVID, it affected their respiratory system. Why is that the case? Every virus has affinity for different tissue. That's just kind of the nature of the life cycle. Epstein-Barr virus, triple-digit Epstein-Barr virus, which is a herpes simplex 4 virus, it loves to affect the thyroid through molecular mimicry, antigen processing. There's many different things that happen, but each virus kind of has an affinity for different tissues in the body. And that is a profile that a lot of people typically come up as positive with, where they're having all of these viral and stealth infections and bacterial infections, even too for my females, bladder infections, chronic bladder infections. You'd want to check to see what types of critters are happening. For men and for women, but I'll speak a little bit to this for more women, that when you're having chronic recurrent urinary tract infections 3, 4, 5, there's something going on there. And that something could be there's a problem with the way the bladder sits in the body. Maybe the bladder is more anteverted. Maybe the bladder is twisted. Maybe you have an arcuate bladder, whatever. Maybe you're not voiding fully. Maybe you have a neurogenic bladder. Maybe you're taking pharmaceuticals that are affecting the nerves to the bladder. There's so many potential possibilities when someone's saying, I'm having multiple urinary tract infections. But what I typically find is that the digestive bacteria, the bacteria that live in the bowels, those bacteria, if they're out of balance, can create chronic recurrent urinary tract infections. And it's a catch-22. I know I'm going off on a tangent, but I just really want to share this point because we're on the topic. It's a catch-22 because, okay, I have a bladder infection, so I'm going to take Bactrim, I'm going to take Cipro, I'm going to take some type of pharmaceutical to get rid of it, maybe a 7-day round. Sure enough, it gets rid of it. But now guess what? I don't have any recolonization of my gut. I didn't re-inoculate, I didn't repopulate, I didn't repair. There's 4 stages of how we support gut health. And there's a process, there's a way to do it appropriately. What ends up happening is now I don't have any basic protection. So I get another urinary tract infection because now my gut's affected. So there's connection, bladder, gut, bladder, gut, bladder, gut. I wanted to just share with you guys. But the reason I'm bringing that up is because sometimes Candida could be causing irritation. Sometimes these stealth infections can be irritating the nerves. The nerves go to the organ. The nerves are the power cord. Think of it like a lamp. So the lamp is the organ. The lamp is the bladder. And the cord that goes to the lamp, that's the nerve. The only way the lamp knows how to turn on is through the cord, through the plug. Well, a lot of these stealth infections or viral infections, bacterial, whatever etiology of origin they are, whatever critter, if you will, whatever microorganism they are, they can change the way the tissue responds or doesn't respond. So that's something to be mindful of too. Viruses love to travel along the nerves, especially Epstein-Barr. They love to travel along the cord that's turning the light on. And imagine if my cord got frayed. My lamp doesn't turn on anymore. So there's a lot of connection there. What else do we want to talk about? Gosh, there's so much, guys. There's so much. There are some things that we can look at. Oh, let's do this. This is a really good one. How did I forget this? Vitamins and minerals. Never ordered. Typically, I find people that come in and maybe they've had their vitamin D tested, but that's pretty much it. We can test for B1, B2, B5, B6, B7, B12, vitamin C, zinc, glutathione, all of the vitamins, all of the minerals, potassium, magnesium, all of those things are included in the vitamin and mineral profile. A lot of you guys have been connecting with me saying, what do I do to protect myself with everything happening right now? And I always say, get your comprehensive lab work because you cannot go in blind. How do we know that you have enough stuff? These vitamins and these minerals have jobs. They're modulating the immune system. They're helping support your cells. They're literally metabolically active. They're doing things. So if you don't have enough stuff, then you don't have enough to provide your body to do the job that it needs to do, whatever that might be. That might be maybe I need to grow my hair longer. Maybe I need to improve my skin texture. Maybe I need to repair my organ. Maybe I need to get nutrients to my thyroid. I'm dealing with Hashimoto's. Maybe I need to filter my liver, clean my liver. All of these things have connections to the organs. Now, I don't suggest, because a lot of people do this, they just say, I'm going to take a multivitamin. I wouldn't suggest that because just because you put something in your body doesn't mean you own it. Just because you put something in your body. So I could take, I don't have any enzymes or supplements here on my desk, but I could take in theory a whole bottle of something. And if my organs are under metabolic stress or inflammation or irritation, I might not process it. So a lot of you guys might be thinking, I'm going to just take vitamins and I'm going to assume that I am bioavailable and that I'm processing them, right? Because I put them in. Please don't think that. More often than not, when I'm ordering the comprehensive lab work, that is something that we see where people do not have enough vitamins or minerals and they're like, but I don't understand, I'm taking it. I'm taking Nutrafol, I'm taking this multivitamin, I'm taking this thing that the guy at GNC recommended for me, I'm taking this thing that I saw this girl on Instagram recommend. No, you can't go in blind. Everything has to be customized for you. And that's really, guys, why I love the comprehensive. It is a picture of you and your cells, and it is only connected to you. It's very customized for you. And like I said, I recommend at least one time per year to do it. That way we get a full picture of what's going on in your body. And like I said, if we're not looking diligently at all of the players in the game, we're gonna miss something. And especially if you're someone that's having a lot of symptoms, I keep seeing these fuzzies. Like, what are they like? I call them my angels. They're like my angel fuzz. But the kind of take home message, if you will, is that the more that we can connect this stuff with your symptoms, especially if you're someone that's very symptomatic and you're like, I am not getting answers to my health. Everything always comes up fine in my lab work. You haven't done the comprehensive lab work. Okay, so it's not really fair to say, yeah, I've done blood work before. You haven't done the comprehensive, unless you've worked with a functional medicine doctor. I'm telling you guys, you haven't done the comprehensive blood work. So just be diligent about, really knowing that there are answers for you. If you're struggling, you don't have to accept that we did all the labs and the diagnostic imaging that we can. We found nothing. No, we treat people, not labs, but there might not be some tests that have been ordered from a conventional perspective. I hope that was helpful for you guys to understand what we're looking for each of the organs. There is so much more. There is so much more to this. I could probably make this video about an hour, but I know that we're a little bit short, on time, and I understand that you get the point. You get the point of, okay, there's a lot of different tests that I probably should have tested to take a look at my health and really my body. If you guys are interested in doing the comprehensive lab work, please connect with me. I will walk you through how that process looks like, what is required, all of the kind of nitty-gritty specifics around if you're interested in the comprehensive lab work. And I hope that you guys found this helpful. I'll see you in the new year if this isn't already up in the new year. Otherwise, leave a comment below on what you thought about this or any clinical questions you might have about lab work, and maybe we'll create another video. See you guys next time.